slide around. But you can see, if I was going to put a tourniquet on and start an IV in this vein, look at when I push it. See how that vein slides around?
Oh, that's
Okay. Now, if I put my finger not on the vein, because you don't, or below it, you don't want to cut off blood flow. But if I put my thumb right next to that vein and pull it taut, I can still see it very nicely. And when I push on it, see how much more stable it is? And it's not going to move around nearly as much. When we're starting an IV, you get right over the top of that vein and you come in. And on a real person, okay, I'm not going to stick this.
Okay.
Come here. By the way, no, you may not start on each other. OSHA really frowns on that. Everybody
when you were in school?
When I was in school, we were not allowed to do venipuncture. So I didn't learn how to do this till I was in practice.
Wow.
Yeah. On the job training. So here's another big difference. When you're on this Mr. Arm and you go to start your IV, you have to come in at a pretty steep angle. On a real person, like if I was going to truly start an IV in the back of her hand, I would be almost parallel and slip it in. Whereas on the arm, you have to come in at a much higher angle. And see, I know where all the differences are because you move from this onto real patients, and what the staff nurses say is that that angle's too steep. Okay. The other thing that happens, we're starting with basic muscle memory. It's very hard to learn how to manipulate all this stuff. And when you slide these cannulas off into this arm, it's much stickier than on a real person. On a real person, I mean, the needle goes in just like butter. And this slides off much easier. And so in reality, I keep picking on you. So in real life, okay, I stabilize this. On the arm, what I show you to do is you get the needle in, and then you let go with this hand and slide that in. In real life, what happens is if you're in a place or you have a patient where that is going to slide around, when you have the tip in and you let go, you're going to lose your access to that vein. It's going to slide off. And in reality, advanced IV starting, you have to figure out how to keep that stabilization going and slide that off. And that's something that I will work with people. I'm going to show you on this advanced sliding off. But you have to start with the basics. You have to start baby steps, get comfortable with the equipment, and then advance to that. Your people that are starting IVs with you are going to help you. They are going to help you. Okay, so when you go to start an IV, you have your needle. This is what we're going to use. It's a 20. Oh, I've got my gloves right here. It's cute. Pink is 20. Blue is 22. It's the size smaller. Boys and girls. Now, one of the things that helps you is you want to loosen this up before you're going to use it. It'll slide off better. But you don't want to slide it up and down like this, because that needle will go right through the side of the cannula really easily, and it'll cause a little spur. So you want to get a hold of it and just turn it around. And you'll see it kind of sets in. It kind of has a little place that goes clunk, and then it's in the right place. So, and you don't want to do it like this in front of the patient. You want to just very subtly flip it around. And what I usually do is I just set it in there like that. It's very soothing and reassuring. You start your IVs the same way every time. You set up your stuff, you talk to your patient, you do your shopping, you do all this stuff the same way. I'm going to teach you how to do a local injection of anesthetic. So we're going to do 1% lidocaine, 2% sometimes, depending on what they have, and it's 0.1 milliliters in a TB syringe. Okay, so I have my lidocaine.
Do you have to have an overflow?
Yes. Yes, you do. I have my tourniquet. I have my prep. We're going to use alcohol, nothing but alcohol on the arms, please. My alcohol. And I'm going to get everything open and ready to go so that I've got it ready when I need it. You need a 2x2 to clean up the mess, because you're going to make a mess. I just know it. You're going to need a clear dressing, and I have plenty. This is a cute little dressing. Okay. It wasn't what I thought it was going to be. Okay, there's a little clear dressing. I will make some tape. I'm going to make 2 fatties and 2 skinnies. I might not use them all this way. Then you need your pigtail. So I noticed that almost all the caps are gone out of my box, so I need to really refresh it. This is your pigtail, so this is where the syringe is going to go in. That's the clave adapter, the non-needleless access system. It's got a clamp on it, okay? That needs to be there. And then on this end, when you put something on the end of this, this is called a lure lock, and it screws on. It pushes up and screws onto it, so it can't come apart. So if you have IV tubing there, it can't come apart. If you have your cannula for the IV coming off there, it can't come apart. So you want to make sure that that's not screwed on, because you'll never get it off. And everything going in here needs to be sterile. Biggest complication is infection. So this cap does need to be on here, but it needs to be on very loosely, because you're going to pick this up and pop that off without contaminating it to hook it into the IV. So we do want to practice with that cap, and it will skunk you, let me tell you. So then I have a flush, and I've got plenty of syringes. I've got plenty of stuff in here for this. So I've got my flush, and the very first thing I'm going to do is prep this. I have to prime it. I have to fill it with fluid. So I have contaminated the end of that, definitely. And you're going to make a ton of trash. We ask that you leave the IV room how you find it, neat and tidy, and all your trash thrown away. And the only thing that goes in here are the needles. Everything else goes in the trash can. Okay. So I'm going to screw this onto here and make sure that it's completely filled with fluid. Now notice how I'm holding that cap so it won't be contaminated in my fingers. Okay, so there's only fluid in there. I'm going to put that on very loosely, and I'm going to set it down right there. So I'm going to teach you how to do a tourniquet before we leave today. I'm really good at teaching you how to put on a tourniquet. It took me a long time to learn how to teach somebody how to do it. Thank you. And it also helps to have a band for the clamps. Because when you're trying to occlude it, and I'll show you in a minute, it's really hard to do. And if it's not flowing, it works better. So I've done my shopping, but I'm going to put this on, and I'm just going to take a look, and I'm doing all my feeling, and I find this beautiful vein right here, and this is where I'm going to put my IV. I have all my stuff set up. I don't have my gloves on yet, though. So I'm going to actually take this off my patient so that I don't have it on for a long period of time, and I'm going to glove up. And my patient is very well educated by the nurse and knows exactly what I'm going to do. Okay. So, I am going to do my local anesthetic first. And I'm going to clean my site. And we're going to use actually chlorhexidine. So if I pretend this is chlorhexidine, it's the friction, the back and forth, the up and down. And I am going to clean a much larger area than what I'm actually going to do, because I'm cutting down on the bacterial content of the skin. So that's chlorhexidine, and it does need to air dry. That's part of how it works. So it's air drying, and I have my lidocaine, 1 or 2%, 0.1 mils. I need to look at the bevel. Now this is just like a PPD, and you guys probably learned this in fundamentals. I'm going to do it on the arm, but this is a very good thing to practice on, because when you're doing this, you want to just catch the tip of somebody's skin. So the needle's right underneath that. And this works beautifully, because you can just catch that paper. Now, you never want to let go of this once you've got it in the skin, because it's going to fall right off. So I'll show you. I do a little traction. If I'm going to put my needle right in here as the IV, I'm going just to the side of the vein. This is not an IV injection. This is going to infiltrate around it. So I go right next to it. And then this hand is like a rock. Don't move this hand. Use this hand to inject with. Now we don't only put air in the arm. Don't put real fluid in the arm. And then out. Now, I do ask that you keep these. So say click, click, and it would go in the sharps in the real room. So I've given them their local anesthetic. It doesn't take very long to work. By the time you guys are messing around, you're ready. So now I've got my needle, and I have taught myself to do an IV start sitting down, but in real life, I never start an IV. I'm standing up. I have to have this angle for some reason, but I can do it with you guys. So if these are open, think traction. Thumbs here, I'm pulling towards me. I'm stabilizing that vein beautifully. You get this right over the top, and I'm going to go right down into the vein. Now this is a pretty steep angle, but it's going to work on the arm. So I go straight down. And did you see the blood come up the cannula and see in there? Mm-hmm. I'm in the vein. Now, I have to go a little bit further because I have to make sure that the cannula is in there. But I don't want to go all the way through. So you bring your angle down and advance truly a smidge more. Here it goes. You can hardly see it.
Yeah.
Now, this hand, these fingers, you're going to get a hold of this and slide it off. This does not move. I do not let go of this ever. So I'm going to slide this off into the vein all the way. And you see how I've got blood coming back?
Yeah.
This is going to help. And in real life, on a real person, this is what you do. You reach up here and the tourniquet comes off first. So it's top, middle, bottom. Tourniquet off. And then you're going to occlude. So you're going to push here. And it's really hard to do it on this mannequin. I am pushing so hard you can't believe it. On a real person, it occludes really easily. When you practice and you're good, you will have a bloodless start. So I'm pushing down. So it's tourniquet off, occlude, and then don't pull the needle out. Click it out. Okay. Now you pick this up, and I'm going to get that off without contaminating the end, and then I'm going to plug up the hole here. Now, once it's in there, I can let go. No blood's going to come out. And what you want to avoid doing is this.
Ouch.
Okay? You want to keep this as stable as you can. Well, and it damages the inside of the vein, and then you're going to get a phlebitis or a clot. So once it's like this, now I can, and you want to avoid touching the insertion site if you can. Okay? We want to keep that as clean as you can. I'm going to get a hold of the cannula, and I'm going to screw this on tight. And then, before we do anything else, I usually stabilize it like this. And now I'm going to check for a blood return. Am I really still in the vein? So I'm going to pull back. Oh, beautiful. And then I'm going to flush. And actually, would you undo one of those clamps? Just one of them, and then it'll go in better. Okay. And now you can clamp that on.
Reclamp it?
Yeah. And then I'm going to put my clamp on here. Now see how I'm holding that the whole time? That's totally stable. We put the clamp on for this reason. It puts positive pressure in this line. When we're in the hospital and you see blood backed up into these saline locks, we don't want to leave it like that because it's going to clot. And then we'll lose that line. It's clotted off. So if you see that, what needs to be done is you need to take a flush, open this clamp, and flush it through.
We can do that right now.
you need me with you. Because if there was a clot in there, it's like, if everything's fine, then there's no problem. But if you push and you have a little resistance, actually, do you know what the problem usually is?
That's on.
But if you hit some resistance, how hard can you push? And it really is an experience to know, because you don't want to put a clot into somebody's system. So at this stage, I think you need to be with me. I'll cut you guys loose to do some on your own at some point in time, but just not quite yet. But next week, let's do some flushes. Not around 9 o'clock meds. Now, before I do any taping, I'm going to still hang on to this, and I'm going to clean this up so I've got all the blood off. Now, I'm actually going to tape with my gloves on. You're going to be very impressed. And you say, Mr. Arm, don't move because you're not taped down yet. Don't move. So I'm going to disconnect this and get that out of here. And the first thing I'm going to do, don't move, Mr. Arm. God, this is going to stay. Let's see what will happen up here. Oh, heck. Okay, real life. This is real life. I'm going to do this and just hold it in place for a minute. I'm going to take my clear dressing, and that's the first thing I'm going to put on. And that goes just on the pink part, not all the way up on the tubing. Because I want to be able to see that site. And if I want to change this, I want to be able to get at it and not take this dressing off if I have to. Okay. Then I'm going to do a chevron just to tape it down. And all a chevron is, see now I put that down there because I didn't want that sliding around. Let's see if I can do this. Oh yeah, I'll be able to do it. I can slide it underneath here. And I'm going to get it up. Come on, baby. Okay, I've got it underneath here, and I'm going to just cross it over so that it's just holding this in place. This takes the place of this with the kit.
Wait,
so that's pretty stable. And then the last thing I'm going to do is I'm going to put the natural curve in this. And I'm going to put this piece of tape across. Now, one thing I want you to notice is I didn't take the piece of tape and just mash it down flat, because that actually pulls this down and tends to pull this up. I kind of put it over and did a little pinch. But see, this is a good tape job because you have minimal tape. This is stabilized. I can see the site. There's one piece of tape here holding this in place. And then you can come in and either hook up some tubing here for an IV and like where the piggyback, start fluids. You can come in here and flush with some saline and then give some meds and then flush it with saline when you're done. So we have access at this. This needs to be accessible. You do want to leave it with your clamp on because you want positive pressure in that line. It's not foolproof, but it certainly helps. Now, DCing an IV, one of the things that I showed a few people today, when you DC an IV, you want to be a little bit careful about when you're pulling it out and putting pressure on the site. Because what you don't want to do is put the gauze on and push down on it as you drag the IV cannula out. Because again, you're damaging the inside of the vein. So what I usually do is I tend to stabilize with my thumb, and then you're going to undo everything. And that way, you can really pull on this stuff. Do I need gloves to take out an IV?
Yes.
Thank you. Pop quiz. Learning to work with tape and gloves is a little bit tricky. Okay, so everything's up. So now, I'm just going to have this ready. And I'm going to get a hold of this whole mess and just pull it straight out and then put pressure on it. And put pressure until it stops bleeding. If they were still bleeding in a minute, I'd still hold pressure on it. Yeah, don't go away until they're done stop bleeding because they're going to have a huge hematoma there. And then, again, I like to use the glove trick where I take this and I pull it down. It's kind of nice. Now, here's the other thing I have to teach you, and then I'll do one at speed. I have to teach you about these needles. Where's Julissa? You know the answer, so you can't answer. Okay. Guess how much one of these costs the school?
$25.
$20.
This.
Which is $25.
No, it's not that expensive.
Oh.
Exactly.
Oh.
This costs $3 to us. We paid $3 for this. Now, you're probably going to have to do a couple dozen of these before you're ready to poke a patient. You're probably going to have to do a couple dozen of these. We cannot afford, now we can buy